Hello, my name is Dr. Shane Martin. I'm a chiropractic doctor and I run the Mission Clinic in partnership with Total Health Nutritional Center. So today I'm going to do an overview of applied kinesiology. I'll start with my story. Years ago, I wanted to study pharmaceutical medicine. I wanted to be a physician assistant, but one day I met or was treated by a doctor of applied kinesiology. He's a chiropractic doctor. His name was Dr. Keeneman. And within 5 minutes, he diagnosed me and he treated me correctly for an issue that I had for many, many years that no one could treat. And so at that point, I realized if I practice medicine, it has to be applied kinesiology. And as I've practiced it, I've been absolutely just blown away and amazed with how effective it is. My vision in terms of treating patients medically is number one, to be humanitarian. Number two, to perform, so to speak, natural miracles, to be able to diagnose and treat people very quickly, and also to be very effective in a profitable business. So I will start with the clinical significance of applied kinesiology. Number one, applied kinesiology, it's a diagnostic system, so it allows you to diagnose conditions very quickly and to find solutions very quickly. So number one, applied kinesiology allows me to perform internal diagnoses to determine, to look at the different systems of the body, the lungs, the heart, the kidneys, the central nervous system, etc., and figure out what's going on. And number two, in terms of psychiatry, allows me to treat people emotionally, allows me to treat, or I should say to assist patients with depression, anxiety, or other limiting beliefs. In fact, usually over 50% of emotional issues are usually organic, usually caused by nutritional deficiencies or low vitamin D, etc. And also, applied kinesiology allows me to determine people's nutritional needs very quickly and to figure out exactly what nutrition or supplements are needed. And number four, it's in terms of physical and medicine, it allows me to determine if bones are out of place or malposition and which way they need to go. So in a sense, oftentimes I don't need an x-ray. I can simply tell which bones are off and put them in place. And especially with disc bulges, I can typically figure out where the disc bulges are and how to put them back in place. So I'll start with I'll start with the history of pharmaceutical medicine, when it started. So back in the 1920s, the most common medicine was natural medicine, homeopathy, herbology, etc., even chiropractic medicine. In fact, during that time, pharmaceutical medicine was not popular because it was very dangerous and caused a lot of problems. But David Rockefeller, one of the first billionaires we've ever had, he invested millions of dollars into pharmaceutical medicine. And not surprising, because pharmaceutical medicine was derived from petroleum or from oil. And so he put millions of dollars into pharmaceutical medicine and was able to vilify natural medicine. And unfortunately, years later, they found that pharmaceutical or petroleum-based medicine caused cancer. And that's when David Rockefeller started the National Cancer Organization to hide that information. So unfortunately, institutional medicine today is a business. It's for money, it's not humanitarian, and unfortunately it's very corrupt, and it's run by, you might say, the pharmaceutical drug cartel. And obviously that's something that we really want to avoid as much as possible. It's at this point I'll go into applied kinesiology. So applied kinesiology was originated, or the father of applied kinesiology was Dr. Goodhart. He was a chiropractic doctor, and this was around the 1960s. And after the death of his wife, he was dedicated to finding a diagnostic system that allowed you to diagnose and find and treat conditions very, very quickly. So what he was able to do was he was able to put together a system of medicine, or bring many systems of medicines together. This would be traditional Chinese medicine like acupuncture, herbs, chiropractic medicine, osteopathic medicine, which focuses on the flow of the blood and fluids in the body, homeopathy, nutritional medicine, herbology. So he was able to take all these systems of medicine that takes years and years to study, and he was able to synthesize them together so that they could work in concert with one another. And we'll go into this a little bit more. Next, I'm going to talk a little bit about the theory of disease. So you have two theories of disease. You have the germ theory, which is what you may have heard of. It's where you have a exogenous germ or bacteria or virus that exists outside of you and infiltrates your body and makes you sick. And so the focus of institutional medicine is to pinpoint and locate these germs and to kill them. Now, the theory of medicine that I practice is called trained theory, or the focus is on stress. So I look at emotional stress, chemical stress, structural stress, and when you remove the stress from the body, and the body can cure anything, whether it be cancer or diabetes, it can cure anything. And you can, by looking at this picture, I think it explains the theory pretty clearly. With trained theory, you have a fish in the fishbowl. You give the fish a clean environment and the fish will be healthy, whereas with the germ theory, there's no focus on the environment. The focus is simply on pharmaceuticals or vaccinations or surgery, but there's no alteration to the environment. So I'll just touch on the triad of health, which I kind of mentioned before. So with natural medicine, with the trained theory, we want to focus on three things. We want to eliminate chemical stress, maybe like toxins in your environment, or toxins in the water or that you drink, the food that you eat. Emotional stress could be anxiety, it could be just limiting or toxic beliefs, and as well as structure. If you have malpositions in the bones or the structure of that body, then you want to fix those. Then once these three stressors are fixed, then the body is clear to heal itself. So we believe the body can heal anything. We just need to remove the stressors and the impediments, and the body can do that very, very well. So next we're going to talk about muscle testing. So with applied kinesiology, if you've been to an AK doctor, then you may be familiar with this, where a doctor muscle tests you. And so this is one of the main tools that we use as AK doctors to find lesions, to find stressors, and to find solutions. So number one, we start with a weak muscle. We want to see if the muscle is weak or strong. And what we're doing is we're testing the nervous system. So for instance, if I were to expose a patient to a vial of arsenic, then they would muscle test weak because the nervous system is weak. Whereas if I were to put some water in a patient's mouth, if they were thirsty, the whole nervous system would strengthen and the muscle would strengthen as well. And so it's sort of like using a voltmeter. Next, we use therapy localization. So what we do is you have a patient put their hand in different parts of their body. And what we're doing is, then we'd muscle test. What we're doing is we're trying to find the lesion. We're trying to find the problem, whether it be a bone. And next, we use a challenge. So the challenge, in this part, we're trying to find a solution. So for instance, if it's physical medicine, I may push a bone in a certain location to see which way the bone needs to go, which way the bone needs to move. And in doing so, rather than using an X-ray, I can simply use this technique and figure out where a bone is malpositioned and put it back in place. I mean, you can use nutritional medicine as well. If I might expose a patient to a vial of vitamin D, and if they muscle test strong, then that tells me that their body needs that nutrient. You can do it with many, many, many things. So here we'll talk about the 5 factors of applied kinesiology. So in applied kinesiology, there's typically, in classic applied kinesiology, there's 5 things that we're looking at and we're trying to fix. That would be the nervous system. If there's a nerve that's impinged, we need to fix that. We're going to talk about the neurovascular system, the neurolymphatics, the cerebral spinal fluid in the central nervous system or in the brain, and acupuncture meridians. So these are 5 things in applied kinesiology we really focus on and try to fix. Once we fix these things, then the body again is able to fix itself. So we'll go on to the first factor. So as I mentioned, the first factor is nerve impingement. So I'll tell you a few stories. So what I typically run into with patients is many of them have disc herniations. A disc is a piece of cartilage between the vertebrae, between the bone and the spine, and sometimes, as you can see in the picture, the disc will stick out and will aggravate the nerves. And when it aggravates the nerves, you have pain going down the legs, you have like really intense nerve pain at times. Pain, if it's in the neck, you have pain going down the arms, down the shoulders, and you have muscle spasms. Using applied kinesiology, I can determine if there's a disc bulge. I can figure out which way the disc needs to go, and I'm able to put it back in place. Now, if I were in a hospital, in institutional medicine, the solution is, number one, you have to get an MRI for a diagnosis, which is very expensive. You spend maybe $600 or more on an MRI. And then for treatment, you'd simply be given oxycodone or some very strong pharmaceutical painkiller. And then at some point you do physiotherapy, different exercises, and then at some point, if it gets really bad, you do surgery. Whereas with the majority of my patients, I can very simply diagnose it and push the disc back in place in the same treatment or the same visits using applied kinesiology. So again, factor 2 is neurovascular. So neurovascular, what it is where the nervous system actually controls the amount of blood that goes to certain parts of the body, whether it be the heart, whether it be the stomach, whether it be the lungs, the brain. And there's things we can do to manipulate this, or to increase blood flow, or to decrease blood flow to certain parts of the body. So I'll give you an example. This is very common with many patients. So I had one patient who came from France and he had knee issues. His doctor told me he needed to have knee surgery. So by fixing the neurovascular points in his knee, we were able to strengthen the popliteus muscle, which is in back of the knee. We were able to strengthen the whole knee. And within 5 minutes, his knee was fine and he didn't need surgery. And he was very, very happy. And I've done this with many, many patients. And this is actually part of osteopathic medicine. Factor 3 is the neurolymphatics. So the lymphatic system is it's a system of vessels, kind of like the blood system, the cardio system. And what it is it's the garbage dump of the body. And the immune system uses the lymphatic system to attack germs or to attack viruses or infections. And oftentimes there will be congestion in the lymphatic system, and then that's paired with different organs. So I'll give you an example. I had a patient who had really bad migraines, and so I took her and I tested her and I found that the lymphatic system, around the kidneys were congested, and so I had to physically put pressure on the lymphatic system around the kidneys, and within a minute or two, the lymphatic system cleared up, and the migraine went away instantaneously. So the Dr. Chapman, we call them Chapman reflexes. There are many reflexes throughout the body that you can massage. You do so, that helps the different systems, the lungs, hearts, kidneys, pancreas. And so with applied kinesiology, you can figure out exactly which part of the lymphatic system is congested and how to fix it as well. So factor 4 is cerebral spinal fluid. This is the fourth factor that we try to treat or look at in applied kinesiology. In the head, in the cranium, you have many different bones in the body. And as you breathe, they're called sutures. These bones actually move very, very slightly with every breath, with inhalation and exhalation. As these bones move, they actually produce cerebral spinal fluid. They actually cause the production of cerebral spinal fluid and the movement of cerebral spinal fluid in the brain, in the central nervous system. And so if some of these bones are stuck, whether it be from trauma at birth, whether it be from sports, or even a motor vehicle accident, these bones can get stuck, and then that's going to cause cerebral spinal fluid to either not be produced in certain parts of the brain, whether it be the frontal lobe or the occipital lobe, which allows you to see. And this will actually cause attention deficit disorders or learning disabilities like dyslexia. So by figuring out like which bones are stuck and fixing them, we allow the brain to produce the cerebral spinal fluid it needs and allows the brain to function normally. So we can do this using applied kinesiology. So the last factor that we look at and work with in applied kinesiology is the acupuncture meridians, or traditional Chinese medicine. So the body is essentially a large battery, and we have 12 or 14 circuits of energy that flow through the body. Each of these circuits are linked to an organ, like either the gallbladder, the kidney, the spleen, the liver. So what we're able to do is so sometimes there may be blockages in the flow of energy with acupuncture. They typically use needles to remove these energy blockages. So with applied kinesiology, we don't need to use needles, but we're able to figure out the blockages in the body and remove them. I'll tell you a few stories. I had one patient who had really bad leg pain, and so using applied kinesiology, we were able to figure out, okay, this patient had a blockage in her gallbladder meridian down the leg. We're able to remove the blockage, and the pain went away instantaneously. A colleague of mine, an AK doctor, had a patient with severe diarrhea, and he found that there is a blockage, and simply by manipulating, I believe it was the small toe on the left foot, the diarrhea dissipated or went away, because he was repairing the flow of energy of the meridian on the left side. So another fascinating part or aspect of applied kinesiology is the gait. So by looking at someone walk, you can get a pretty good idea of internal problems. For instance, if someone has diabetes and they have problems with their kidneys, and the kidneys, if they're not doing well, this can affect muscles called the psoas muscle. And if people are walking it with externally rotated feet, then you think, oh, maybe they have problems with their kidneys, diabetes. Other people who are slumped forward as they walk, they may have issues with their small intestines, or so they may have SIBO, small intestinal bacterial overgrowth. Or patients who are walking sort of like they just got off a horse, kind of like saddled, or then they may have inflammation in their colon, or other patients who are really leaning backwards as they walk, especially older men. They have problems with their prostates. So it's absolutely fascinating. I can sometimes when I'd fly, I'd love to sit in the airport and watch people and get a pretty good idea or diagnosis, or internal diagnosis of what conditions people may have, simply based on how they're walking. And so we can do that with applied kinesiology, of course. So that was a very general overview of applied kinesiology. I mean, uh, when I was in chiropractic school, and chiropractic school it's like medical school. You have to go there for 4 years, and that's after you've gone your bachelor's degree, which typically is going to be in biology. I had to study for many, many hours, like hundreds of hours, on top of my chiropractic schooling in order to study applied kinesiology. It's very, very demanding, so that's just a very brief overview of a case. Right now I'm going to go into some of the tools I use in my practice. So, I mean, the first tools are, we'll start with applied kinesiology. I mean, we already talked about that a little bit. Meridian therapy. I also do iridology. And again, I'll be going over all of these in the next few slides. So iridology, homeopathy, herbology, nutrition, Bach flower remedies, and vial testing. So this is just a very comprehensive overview of some of the tools that I use. So let's move on. So iridology is an absolutely fascinating diagnostic system. It was one of the fathers of American iridology was Dr. Bernard Jensen. He was, I believe, he was a chiropractor. He was a naturopathic doctor. He had a PhD. Anyways, so I learned iridology from his material. And with iridology, by taking pictures of the iris, you can actually see the different systems of the body represented in the iris. I can see the nervous system, the kidneys, the pancreas. I can see the lungs, the heart, the gallbladder, the liver, the nervous system, large and small intestines, all represented in the iris. And I've taken hundreds of pictures, and every time when I've done a diagnosis, the diagnosis has been spot on. In fact, I used to practice iridology in the traditional medical schools back in the 1920s until pharmaceutical companies got them kicked out. So some of the common things I tend to come across using iridology is I can see low hydrochloric acid in the stomachs. A lot of times I see deficiencies or weakness in the tissues and in the organs, like the small intestines. A lot of times the lungs, the heart, the kidneys. I can see inflammation in the nervous system. That's been really common. I can see toxins. I can see which organs the toxins are in. Another thing I see, which has been fairly common, is called diverticulitis. It's where you have pouches in the small intestines and they get very large and the food gets stuck in there, and it causes inflammation and pain, sometimes pretty severe pain. So being a chiropractic doctor, I'm not allowed to prescribe pharmaceuticals, which I'm happy with. I'm happy not to. But instead of using pharmaceuticals, I use homeopathy, nutrition, and herbology. So here I'll talk about homeopathy a little bit. Homeopathy is absolutely fascinating. It's natural, it's safe, and pharmaceutical companies hate homeopathy. Homeopathy is actually part of mainstream medicine in India, Mexico, I think Pakistan, and a few European countries, France, I think Sweden, possibly Germany. So with homeopathy the idea is that like here is like they'll take natural ingredients, they'll dilute them to incredible degrees, and then they will give you those remedies. And homeopathy has been excellent for treating skin issues. I had one story. I had one patient who had epilepsy, a really severe case of epilepsy. She even had an implant placed in her to help control the epilepsy. And she was on medication. She was having seizures at nighttime, and she was really afraid of having a seizure while she was driving. So I took her into my clinic, and I was able to figure out which homeopathy she needed, and I gave it to her. And it's been a couple of months so far. She has not had a single seizure yet. So, and I've had many other just incredible success stories using homeopathy. So as mentioned, I use nutrition, I use herbology or herbs. And the wonderful thing with applied kinesiology is I don't have to guess. Now, they did a study and they found that 80% of diseases were caused by malnutrition. So it makes sense then to treat these diseases with nutrition. So using applied kinesiology, I'm able to figure out exactly what herbs or what supplements, what vitamins, what minerals a patient needs, and also how much they need. So I don't have to guess. And so I've had a lot of success with this. I had one patient who is a little boy. He's having really bad dreams or nightmares. And so we gave them a supplement called Arginex by Standard Process. It works with the kidneys. And since then, he hasn't had any nightmares. So, nutrition, herbology, homeopathy works. As Hippocrates said, let thy food be thy medicine. So again, one of the large tools I use is applied kinesiology. We already talked about it. And you can see the previous slides. And, okay, let's move on to the next one. So for in-house testing, I've been using vials, and this has been just a game changer in my practice. So with vials, they take a homeopathic, samples different things. So using vials, I can test hormones, estrogen, insulin. I can see if I can do is I can't use these vials for testing, for diagnosing, I should say. But I can get a general idea to see if anything is present. So I can look at people's hormones and see if they're high or if they're low, whether it be reproductive hormones or digestive hormones. I can check for candida, see if that's present. I can also do a complete blood count. That's when you get your blood drawn. Usually your doctor will look at your complete blood count or look at your metabolic profile, and you'll spend hundreds of dollars doing that. So in-house, I can look at insulin levels. I can look at the hematocrits. I can see if there's how the iron levels are doing in the blood. I can see how the liver is doing. I can check for high levels, low levels. It's absolutely fascinating. It's been very effective with my patients. And also check for biofilms. Biofilms are something that germs use when they infiltrate the body as kind of like a protective mechanism. And unless you get rid of this biofilm, then oftentimes the pharmaceuticals or the herbs aren't going to work to kill off these microorganisms. So you have to get rid of the biofilms first. So we can test for that. I can also look at heavy metals. I can see which ones are present. And I can also test to see which ones need test to see what supplements will actually remove those heavy metals. I can look at environmental toxins, I can look at food allergies, and I can look at microorganisms. I can see if the body is dealing with any bacterial infection, parasitic, viral infection, or for fungi or mold. And these days I've been seeing a lot of parasitic infections in patients. So this has been just incredibly helpful in my practice and for my patients. Another tool I use is Bach flower remedies. I use this for emotional stress or for emotional problems. So what happens is people will have limiting unconscious beliefs. And back in the 1920s, Dr. Bach, he was a physician who helped pioneer vaccine technology. You realize the vaccine technology just wasn't working. A lot of diseases were caused by emotional imbalances or stress. And so he found that if you take homeopathic flower essences, then you can actually treat very specific emotional problems. And I've used this one with my patients, and it's been very effective. So we already talked about meridian therapy. So again, I use meridian therapy. I don't have to use needles. All I have to do is figure out like which points is blocking the flow of energy in the body. A common thing a lot of times is the liver. So if patients commonly, if they wake up at 3 a.m. in the morning, like time after time after time, then usually I'm gonna think, okay, the liver or the gallbladder. Or if it's 4 a.m., then I think maybe they may have there may be problems with the lungs. And so again, using meridian therapy, we can correct these imbalances in the energy. And a thing I've been using recently has also been I've been looking at chakras in the patients. Chakras look at the different levels of energy in the body. And if certain chakras are off, then they can cause specific emotional problems. And so I've been using it recently to deal with patients who have traumatic experiences or have maybe even PTSD, and it's been effective so far. Well, there you go. That was an overview of the system of medicine I use called Applied Kinesiology for diagnosing and treating patients, as well as the tools that I use. So if you found this helpful, you can share it with a friend, and they'll get a $10 discount off the first patient visit if they use the coupon code SEMINAR. I hope this has given you some tools for explaining just the incredible effectiveness of a natural health and applied kinesiology to your friends. Because I get it, this stuff can be very difficult to understand or to explain. So hopefully this has given you some ammunition when you have conversations with friends about health. And if you'd like more research, you can go to, I have 2 blogs, one on applied kinesiology, one on overview of treatments on my website. And that goes more into the nitty-gritty or the research for those who are interested in that sort of thing. So in general, I found that applied kinesiology has been an excellent tool, and it's been far superior than my experience with institutional medicine. Again, if I had an emergency, I would most likely go to an emergency room, but for general problems, I would definitely prefer a very good practitioner who did natural medicine, specifically applied kinesiology or naturopathy, as they do at the Total Health Clinic. The Total Health Clinic is just absolutely amazing. So if we want to return to natural medicine, then this really has to be a grassroots movement. I mean, the pharmaceutical companies, as we know, have billions of dollars, absolutely billions of dollars. I think over COVID, the CEOs of these pharmaceutical companies just became billionaires overnight. So the money is on their side. So again, this really has to be a grassroots movement. Fortunately or unfortunately, just how it is. So again, my vision is to be effective, to be very effective at diagnosing patients and treating them naturally and treating them quickly, and also just having a business model, a clinical business model that can be duplicated by other clinicians, and that is just makes business sense, because you can't be simply humanitarian, because you're going to run out of money like within weeks. And so again, my objective is to be effective, to have a good business model, to be a good business, but also not to compromise any of my humanitarian intentions. So I hope this was helpful, and wish you the best. Take care.